Hello, good evening. Before I start my class, I just want to wish each and every one of you a happy Easter. I just hope that you will really understand the meaning of it and you will begin to lead your life accordingly. So, coming back to the class, I had dealt with nitrogen mustard. I had completed even the antimetabolites. Now we are going to move over to the third category under cytotoxic drugs, and that is called as the Vinca alkaloids. Okay, Vinca alkaloids, where we will be just seeing only two drugs coming under it. We have vincristin and vinblastin. Vincristin and vinblastin. Now I just want to say a few features about vincristin. Vincristin is otherwise called as the oncovim. The other name for that is oncovim. Okay, so Vinca alkaloids, they are usually called or classified under as plant alkaloids. Vinca alkaloids, they are categorized or they are coming under the category of plant alkaloids. Now, to speak about the characteristic features of Vinca alkaloids, I just want to tell you that Vinca alkaloids, they are considered to be as mitotic inhibitors. Mitotic inhibitors. They are considered as mitotic inhibitors. And they are called as a cell cycle specific. Cell cycle specific. So basically they will be arresting in the metaphase of the cell division. So how this particular group or this particular category will be having an effect upon the cancer cells is they would be coming in contact, or they will be attacking mainly the tubulin content or the tubulin features or the tubulin apparatus in the cell division. Now, talking about tubular protein or tubular apparatus which is present in the cell division. Now, this particular group is considered as antimicrotubule agents. They are considered as antimicrotubule agents. Now, what is the use of a microtubule? Microtubule is actually a cell apparatus which is responsible for division and replication of the cells. Division and replication of cells. So if this undergoes inhibition, it's going to result in cell death. It's going to result in cell death. So the other name for this is antimicrotubule agents. Okay, so Vinca alkaloids, it's otherwise called as a plant alkaloids. They are even called as the mitotic inhibitors. They are said to be cell cycle specific, and at the same time they are called as antimicrotubule agents. Okay, so moving over to vincristin and vinblastin. Both of these drugs, they are closely related chemically, okay, but they exhibit out a wide variety of features when it comes to the activity as well as in the toxicity. So they hold a wide variety or a wide spectrum of anti-tumor activity as well as the toxicity too. Now I'm going to start off with vinblastin. Okay, I'm going to start off with vinblastin. So vinblastin, if you see the uses, it will be employed with other drugs. Basically, in case of Hodgkin's disease, in case of testicular carcinoma, these are the main primary areas where they are going to administer this particular drug. Okay, and it's given basically intravenously. Intravenously, this particular drug will be given, and this Vincristine and vinblastine, they are considered to be vesicants. That means it causes a lot of inflammation if it escapes from the vein and enters into the surrounding tissues. Okay, so this particular drug has to be specifically given by a trained personnel for this particular in this particular field, especially upon the patients. So the side effects, coming over to the side effects, when you consider, it is said to be manageable, but once the treatment gets completed. And the common side effects we can find is low blood counts, and you can find fatigue, there will be weakness, and very common side effects that we can find is nausea, vomiting, poor appetite, peripheral neuropathy, especially they will be feeling some tingling sensation or in their fingers. Okay, they will be experiencing all those. So there will be fatigue, weakness, and apart from that, constipation. Constipation, usually after 1 to 3 days they start complaining of constipation, and followed by that they start complaining of abdominal cramps. There will be diarrhea, there will be fever, mainly if the fever comes around above 100, or even it keeps on raising. It's always good to intimate the healthcare professional or intimate the consulting doctor in that area. And apart from that, they will be having alopecia, hearing loss, mouth sores, taste changes, especially they will be complaining of metallic taste, and because of that they don't feel like taking their food on time. So we have to inform the patient that they will be experiencing certain taste changes. Basically they will be experiencing metallic taste, and they will be having headache, depression, jaw pain. They will be experiencing myalgia, arthralgia, hypertension, shortness of breath, and even pain. They will be complaining of pain in the bones. Okay, so these are the areas where you can find a very less common side effects. Okay, and bone marrow is, depression is very prominent, and this has to be considered. So we have to ensure that we run a complete CBC, or a complete blood counts should be taken into consideration when we are dealing with the patients in relation to vinblastine. Okay, so if you see there, it's not that all the patients will be suffering from all these kind of particular side effects. There are certain patients, approximate around 10 to 20% of patients, they may suffer from certain set of complications, or maybe 30% of it, not all of them, with all the particular common side effects. So that we need to remember. Moving over to vincristine. Okay, vincristine, I said the other name or the other commonly used drug, commonly known, is oncovin. So its feature is it's a rapidly acting drug. It's a rapidly acting drug, and it is very useful for inducing remission in childhood acute leukemias, but it's not good for maintenance therapy. It's good for inducing remission in childhood acute leukemias, but it's not at all a good choice, or it's not a good area for to be dealt in terms of maintenance therapy. Now, the other indications where we go for administering vincristine or oncovin is acute leukemia, Hodgkin's and non-Hodgkin's lymphoma, neuroblastoma, rhabdomyosarcoma, Ewing's sarcoma, Wilms tumor, multiple myeloma, chronic leukemia, thyroid cancer, brain tumors, and even in some areas where they have blood disorders. Okay, now side effects. Moving over to the side effects, the prominent adverse effect you can notice over here is peripheral neuropathy. Like I said, peripheral neuropathy, If you see vincristine, vinblastine, it is a common side effect that you can find. Okay, peripheral neuropathy you can find, and where 30% of them, they may complain, or they usually complain of alopecia, but usually this is reversible once the treatment has been completed. This is usually said to be a reversible process. Very less common side effects we can notice is constipation, low blood counts. So low blood counts, we should remember, in both the areas we found, or we can find, there is low blood counts. So you have to ensure that patient is being monitored for any signs of infection, and they don't suffer with anemia, and they are very prone for even a very bleeding and all those. So we have to monitor the patient in these aspects. And you have to ensure that they don't suffer from abdominal cramps, weight loss, nausea, vomiting, mouth sores, diarrhea, anorexia, and taste changes. So these things we have to ensure that the patient doesn't suffer from. Usually they may suffer, but ensure that if there are certain areas where they are very high risk, so you have to ensure that these things are monitored and your patient is kept very safe. So coming over to the dose, usually vincristine we will be administering at a dose of 1.5 to 2 milligrams per meter square body surface area, and it will be given intravenously as I discussed, and it will be given weekly. Vinblastine, the dose administered will be 0.1 to 0.15 mg per kg intravenously weekly for 3 doses. With 3 doses they will be administering. So with this we have completed Vinca alkaloids. Okay, so Vinca alkaloids is basically called as a plant alkaloids, and they are said to be cell cycle specific. So basically they will be arresting the cells at the metaphase area. They will be arresting, or they will be going for it, and they are said to be cell cycle specific. They are also called as anti-microtubular agents because they will be interfering with the microtubules, and they will be inhibiting it. As a result, it will not be favoring, or it will not be adding or playing a role in cell division. Alright, the division and the replication of the cells will be getting affected. As a result, the cell death will also be happening over here. And it's also called as mitotic inhibitors. Basically in the mitosis phase, they will be undergoing, mainly the metaphase area will be getting affected over here. We have 2 drugs that we'll be dealing with it, vinblastine and vincristine. The vincristine is otherwise called as the oncovim. It's a rapidly acting drug, and it's very useful for inducing remission in childhood acute leukemias, but it's not a good drug of choice for maintenance therapy. And it can be used in other areas, like in case of Hodgkin's and non-Hodgkin's lymphoma, and neuroblastoma, rhabdomyosarcoma, Ewing sarcoma, Wilms tumor, multiple myeloma, in case of chronic leukemia, thyroid cancer, brain tumors, and in certain blood disorders. And coming over or moving over to the side effects, we can find that 30% of them, they suffer from alopecia, but this is reversible or manageable once the treatment gets completed. Okay, and very less common complaints they suffer from is constipation, reduced blood counts. Okay, and this you can find it during the nadir period. Okay, so nadir is actually a point or a time, or it's a point during your chemotherapy cycles where the patient will be, or you can find decreased blood counts. So like for example, it start with its onset will be within 7 days. Okay, and the nadir point will be 7 to 10 days, and the recovery time it takes for it is 21 days. Okay, and followed by that, the patient will be complaining of abdominal cramps, weight loss, nausea, vomiting, mouth sores, diarrhea, anorexia, taste changes, and the prominent one that you can find in both vinblastine and vincristine is peripheral neuropathy. Okay, and the dose that we go for administering vincristine is 1.5 to 2 mg per meter square body surface area intravenously and weekly in weekly basis. Moving over to vinblastine. Vinblastine is also employed with other drugs in case of Hodgkin's disease, testicular carcinoma. Okay, these are the primary areas where it's very, very useful. And usually if you see the side effects, they also suffer from low blood counts. There will be injection site reactions, fatigue, weakness. Very less common side effects we can find is nausea, vomiting, poor appetite, constipation that will start within 1 to 3 days after the initiation of the treatment. Sometimes it will be followed with abdominal cramps, diarrhea, fever, alopecia, hearing loss, mouth sores, taste changes, metallic taste can be noticed over here, headache, depression, jaw pain, bone pain, hypertension, shortness of breath, myalgia and arthralgia. These are the other complaints we can notice for. And there are certain important things, and I forgot about the dosage. The dosage that we will be giving in case of vinblastine is 0.1 to 0.15 mg per kg intravenously weekly, 3 doses. Now, nurse's role, we have to ensure that they would, once the treatment starts, they would be monitoring a complete blood count of the patient. Monitor the patient for any signs of infection, bleeding, okay, and we have to protect the patient. So monitor their vital signs, ensure that you keep up to date, encourage your patient to take the food. Because of the metallic taste, they would withdraw themselves from having their food. So ensure that their nutrition needs are met. All right, and in case if the patient suffers from fever and it keeps on raising, you have to give a high alert and inform to the consulting doctor. And another important thing is you have to ask the patient if they are on any other medications. So the medications note has to be included so that unnecessary reactions could be avoided. When it comes to pregnancy, ensure that, or you have a checkup with them, ensure that they are not carrying. And in case if they are found to be pregnant, you have to explain to them there will be side effects, or they will be having very bad effects during their pregnancy period and even upon the fetus. So we need to inform them about these matters. So these are simple and important points you need to keep up in the mind. And one more thing what I need to ensure or tell you is, if the patient complains of any black tarry stools, please inform to the doctor. So these are the common things: nausea, vomiting, all these things, diarrhea. If the episode in a day, if it is more than 4 to 6 episodes in a day, it is very, very important that we consider and we take necessary measures to treat the patient on that aspect. So I hope you have understood this class and it was useful for you. Thank you so much for joining me and taking your time. Take care.